Good afternoon. My name is Aileen McNabb-Coleman, Chair of the Cayuga County Legislature. We knew this day would come, but it doesn't make it any easier to share the sad news with you that the first person in Cayuga County has lost the fight against coronavirus. I extend my heartfelt sympathies to this person's family and friends. Let this be a stark reminder that this virus is real, that it is in our community, and that it kills. While the majority of us may get away with mild symptoms if we get the virus, this is not the case for our older family members, friends, and neighbors, and those who have underlying conditions. And these are the people we must protect by staying home as much as possible and leaving the house only for essential activities. The sooner we all comply with social distancing and doing the right thing for others, the more effective we will be in slowing the spread of coronavirus in our community. We all experience this pandemic in different ways, but we have one thing in common. All of us have a role to play in slowing the spread of this vicious and invisible virus that has taken over our community and the world. We all need each other more than ever to get through this. We just can't do it in close proximity. This is not the time to think of ourselves only, especially if you are healthy and not at high risk. This is a time where we need to think of and protect others. As hard and counterintuitive as it may seem, the best we can help others now is by not meeting with them in person. People are dying in New York State. People are dying in counties around us. And now we are mourning the first person who died in our community. We need to stay vigilant about protecting ourselves and others and not spreading this virus further.
Good evening. My name is Kathleen Cuddy. I work as the Public Health Director here in Cayuga County. Today we lost a member of our community to COVID-19. I extend my sincerest condolences to this person's friends and family who are grieving this loss. The decedent, a male in his 40s, had been hospitalized since April 1st, 2020, and had underlying chronic health issues which may have contributed to his death. Out of respect for the privacy of the deceased and his family, we will not be releasing further information. The contact tracing investigation for the deceased individual had been performed and is completed at this time. I cannot reinforce enough the importance of social distancing at this time. For weeks, we have been asking residents to practice social distancing by staying home, limiting trips to stores and public places. This is not the time to get comfortable or complacent with our behaviors. While New York City may be experiencing declines in their numbers, Central New York and specifically Cayuga County are seeing an increase in numbers of confirmed cases of COVID-19. Research is showing that individuals can transmit the virus 2 days before symptoms of illness appear. This is why staying home and practicing social distancing matters. Right now, we need to focus on what we can do to prevent the spread of this illness. This virus does not discriminate. It does not matter if you are male or female, does not matter how old you are or where you live. The virus is throughout our county and it has caused a death of one of our own. Social distancing is the most effective action we can perform to slow the spread of this virus amongst each other. Staying home when you're ill, wearing a mask in public while limiting your trips, and frequent and thorough hand washing are also important. Everyone plays a role in preventing the spread of this virus. Complying with our recommendations is imperative to protecting the health of our community in the days and weeks to come. Thank you. Any questions right now?
Kathleen, for you first. I know what's been talked about, vulnerable populations and people with underlying health conditions, which have been pointed out, but to lose someone so young, does that kind of highlight that no one really is immune from this, that even at a young age, if you have even just one underlying health condition, you could be at risk of serious something?
I think you articulated that very well, Robert. You are correct. This virus does not discriminate against age. We may be seeing the most deaths statistically amongst our older population, but clearly this impacts younger people as well.
You mentioned that this person was in the hospital for a week. I guess how did that process play out with testing? Because I believe, just winding up the data, I think that test came back sometime later in the week. Does that hinder the ability to care for a person?
It would not hinder the ability to care for the person simply because we're treating the symptoms in the hospital. It is helpful to understand whether the person has the virus or not as far as keeping track of statistics and certainly maintaining safety precautions for our healthcare personnel.
Sure.
First, with this news, and you mentioned the social distancing, if there's any more from a local government standpoint that can be done to reinforce this? I know that obviously there's a lot of limitations already, but do you think more needs to be done to drive the point home that people need to exercise caution during this time?
We are at a point now where we have something that's happened that's very unfortunate. But it is a glaring reminder that we need to stay home as much as humanly possible and only go out for what is very essential. I made a trip down here today because it's essential that I'm here today. Otherwise, I'm staying in my area. Everyone should be doing the same. This is an ongoing conversation in terms of future orders or more limitations. This is, this just kind of highlights the fact that we need to comply. There's, I believe, orders in place that should limit the spread, but we need the compliance there. But this further strengthens our conversations that we are currently having. So,
maybe Kathleen could answer this too, but do you think there needs to be more protection for essential workers? I mean, there's healthcare workers, there's people who work in essential businesses that are getting sick because they're out in public. We say that these are essential functions, they can continue, but how do we best balance that? Because it seems like some companies are voluntarily saying, here's PPE, here's different safeguards, but some aren't taking those steps. So how do we balance that?
it is very concerning. I'm happy that some private businesses have stepped up. For instance, at the grocery store, putting the plexiglass, allowing them to wear gloves. Our docs, the state doc system is allowing corrections officers PPE. I think that needs to become more widely available. I would like to see more done locally with our local businesses in protecting the workers. I know, we have mandated services at the county. We have people that need to go into other people's homes for adult protection, child protection. Those people are provided with PPE and the proper protection to carry out that job. But I'm immensely thankful when I leave my house and I have to see people who are in the workforce. They're very brave. I'm sure they're stressed. I think I've said it before, a kind word or a gesture can go a long way at this time for those folks. But certainly I think more people need to continue to step up, but we've had some good examples in our community.
Is there any guidance that the health department is giving to essential businesses, employees, older employees at essential businesses, how they can protect themselves at this time?
I think what we are finding is that business owners who are able to provide more distancing, perhaps a mask or some other sort of physical barrier, are doing so because not only is it the right thing for their employees, but it's a smart move for their business. Everybody wants to protect their workers. That's the only way you can keep your business operating well.
Just one more question for you. Apart from this, I know that we've been getting messages about different activities happening outside. I know that the playgrounds are closed and there were some other measures taken, but we've heard about golf courses and some of these other settings where people are feeling free to go out, not necessarily doing that social distancing that they should be doing. Do you plan on taking any further action to address some of those other settings as well?
There are ongoing conversations. I was on the phone today with some golf course owners today to discuss what's being done. You know, it's disruptive. This is very disruptive to our lives. It's disruptive to the season. It's disruptive to our children. It's disruptive to seniors. It's very difficult to regulate private business, and it's people's livelihoods. And I don't take it lightly. But a short-term disruption for a long-term health is, you can't balance that. It's something that I can't justify. Somebody feeling uncomfortable or irritated that they can't go out about their daily business. Here we are, we have somebody right in our community who has suffered and passed because of the coronavirus. So, I think mild disruption pales in comparison. We need to get our priorities straight on this.
Just lastly, anybody can take this, I guess, but I know that we've talked before about testing and the availability of the PPE and the test kits to do that testing. Any progress on that front? I know the state was going to send more. The testing, it seems like testing picked up, so I wondered about the availability of that equipment to do that.
Sure, I'll let Kathleen address it.
So you inquired about the availability of PPE and testing, and I will say I am pleased that we have received, and I think in large part, some of the advocacy that has been performed by our legislative chairwoman, additional tests to perform swabbing. We are finding the laboratory turnaround time is improving, and PPE is best answered by our emergency manager, Amy Russett. But it appears right now for our staff in the health department, we have enough to perform our duties.
Additional positive case today.
Deanna's going to send out the update now. And the answer is yes.